This podcast is for entertainment purposes only and does not substitute for professional medical advice. Please seek a medical professional or healthcare provider if you're seeking any medical advice, diagnosis, or treatment. Thanks, everyone.
All right, I'm good. I don't know what's going on with me. Okay.
I think it might just be some stupidity with the camera.
Okay, cool.
It really,
But you saw it, right? I'm not crazy.
I saw it once you pointed it out, yeah. But I don't see it
right
I
now.
haven't seen it at all.
Okay.
Throughout any moment. Now, before, like, in person, I hadn't seen it.
Okay.
And even, like, now with the makeup, even, like, I don't see it at all. You see, I don't see it here.
Yeah, I don't know what the fuck is going on.
I think it's the grid. The grid
Maybe
makes
it's the
like
grid.
an illusion.
I don't know. Welcome to Funny Medicine. I'm having a heart attack right now because I thought that I was having a Bell Palsy episode.
Yeah, she does it. She's okay.
Maybe you guys can let me know if you see it or not.
Which eye is it that?
This one.
That one. Okay, so she thinks that one looks a little droopier
Smaller.
than
Yeah,
like
droopier
the other
than
one.
the other one.
I don't see it. She sees it.
And it's weird because I don't see it when I look at myself.
Yeah.
Yeah, no, I don't see it. I know
I think-
like eyes aren't going to be like 100% symmetrical, but I got really scared for a second. I was like, chilling.
Yeah. So, hi, this is Funny Medicine.
I'm Evie. She's Julie.
And today we're going to be talking about something we haven't done in a bit, but there's a lot of news. We're going to stay away from the political bullshit at this
Oh my
point.
God, the
you know,
political stuff
it's just too much.
Kind of crazy right now.
It's just I feel like it's not even relevant. Like it's not even relevant. It's just like so like everywhere where that other than it needs to be. So we're not gonna have this be political. We're just gonna talk about actual just medical science-y like news that's out there that we thought that it was pretty interesting.
Want him to see my eye. Babe, is there something weird about my face?
No, why?
Babe, I swear to you, I asked Julie, I'm being very serious right now. You don't feel like this eye is droopier?
No.
You see?
Okay. I was having a heart attack, babe. I was literally gonna.
Did you get Bell's palsy?
Yes. Yes, babe.
Smile.
No, I already tested myself. Everything is symmetrical.
Don't worry, you're fine.
But anyway, no,
You
but
see?
ask Julie, babe. I was gonna text you and I was like, babe, we need to go to the hospital. I really thought that my eye was droopy.
No, you're fine.
Okay, that's it. I just want to say
Missing out. And hi, Julie, how are you?
Hey. Oh, good.
she didn't catch it on recording.
I know.
We
Damn
should have
it.
caught it on recording, but I was freaking out, babe. I really thought that I had like a droopy eye, and I almost started crying because I thought that I was getting a Bell's palsy.
Oh, come on.
Okay. Have fun studying. I love you.
Talk to you guys. I love you.
Bye.
Bye.
Okay.
He's studying?
He has his boards coming up. Pain.
Oh, for like,
Yeah.
I was so confused right now.
For what? For what?
Did you like?
Yeah.
I was like
like
that.
pink.
I was like that meme with the with the other thing.
math. The math. Hold on.
Hold the fuck on. I
For
thought
pain,
we
for
were
pain.
all over this already.
Yes.
Okay,
Yes.
okay,
He
okay.
has his pain boards, and that's it. Then he'll be like officially.
Oh Jesus.
done.
Okay.
All right. Anyways.
Wow. Okay. So
Okay.
massive deviations
Yes.
here. We just got confirmation from her man's,
Yes,
which is
my
also a
mans.
doctor.
That I do not, in fact, have a droopy eye.
Yeah, so you've been consulted by me or no one, by yourself, somebody, and then by your man's.
And
which
wait
is a
until-
full
wait
blown
until
doc-
Mario
Oh,
wakes
then
up.
that's a whole other
Because I'm
consultation.
gonna have Mario check me.
Yeah, I know you are, and then he's gonna also laugh at you because he knows you, and he's gonna
Okay.
do the same thing as Mike did. Like, smile, you're fine.
You're fine. Okay. Can move forward. Move on. Anyways, today we're doing a recap. What we were saying is that we're not going to get into the political side of things.
Yeah, we're gonna just keep it medical news,
Straight medical.
relevant stuff that maybe you guys didn't catch because the political news is so overwhelming these days. So let's go ahead and bring something interesting to the table, and we've done a little summary of them. So here we go. Go with the first one.
Okay, perfect. So the first one is seeing infrared. Scientists create contact lenses that grant supervision, which is crazy.
That blew my mind.
Yeah. So this is by Ian Sample. Sorry, what? Ian Sample Science? By Ian Sample Science?
On science. I mean, yeah, no, wait. forget that. Just Ian sample.
Ian sample. Okay.
I don't know why that was in there, because it's from the Guardian.
Oh, okay. So this is
His
by.
last name cannot be science.
I was gonna say.
I was gonna be like, you need to dedicate your whole life to science.
Yeah. All right, this is by Ian Sample, and this came out on May 22nd, 2025, and this was on The Guardian. Yeah. So researchers at the University of Science. Oh, okay, yes. Just continue reading even. I was like, another science. Anyways, okay.
She's fine, guys. She's gonna be fine. Let me turn out the fan.
Maybe I am. Maybe I am having a stroke. I don't know.
You're not. Just
fine.
had a telehealth visit.
Yeah. Oh my God, I literally freaked out. Okay.
You're fine.
So researchers at the University of Science and Technology of China have packed the upconversion nanoparticles into soft contacts, okay, that turn near infrared light, normally that's invisible to us, into visible red, green, or blue. So you basically put these on, you slip them on, and you can spot coded flashes from an IR LED while still seeing everyday colors. No like bulky goggles or like those like crazy headgears that you have to wear to see all of that. Yeah. It's all through contact lenses, which is crazy.
Is that not insane?
Yeah, that is
because
really
one of the things that keeps me up at night, and if you've watched me on TikTok, you've probably caught this mini episode of mine, is the fact that we see so little of what's actually out there because the visible light spectrum is
teeny bit. So I don't think people like get that.
They don't get that. Yeah. And I'll put it here for whoever's watching on YouTube. Yeah. You probably should.
So what we see in the whole entire spectrum, right? There's a massive spectrum.
Yeah.
And imagine we see a lot of colors, right?
Yeah, that's it.
We see a lot, but it's only in the grand scheme of things, it's actually only a little piece.
Exactly. So this opens up a little bit more.
Can you imagine?
We could then
if
see
we unlock
infrared.
Other.
That's what we're doing with this.
I know, but like more.
I know, right? Exactly. This is just like the first step. Can you imagine like what is out there that we'll discover because we just hadn't seen it before?
No.
Like
crazy.
Birds are able to see like the magnetic, whatever.
Yes.
And that's how they I forgot the
ultrasound. It's
like it's the magnetic poles and they're able to like see it and whatever. And it's like this whole thing that happens. And even whales, like the beluga whales and whatever. And that's how they like communicate and like go about. So that's freaking mind blowing. If we're able to like even just see a little bit of that, how much more is there out there that we just don't know because we can't see it?
Yeah.
It's like right in front of our faces right now, and we just can't see it.
Yeah, I know.
Is that not insane?
That's crazy.
Yeah, so I thought this was mind blowing.
Yeah, it is mind blowing. So basically, the nanoparticles soak up the wavelength just beyond our 700 nanometers. Which is this like that tiny bit that we can only see, and then it re-emits it to inside those lenses to like the visible range. Okay. So then in mouse experiments, these same particles were injected behind the retina, but the contact lens version ditches the needles for a much friendlier and like, not scary. Yeah. We're going to inject these.
And then you're like stuck seeing that forever. Instead of just being like, okay, that's too much. Let me just take this off.
Yeah, no, it's too much. I mean, I can imagine, like just adjusting to glasses is hard.
Exactly.
Imagine adjusting to like more.
To things you've never seen before.
Yeah.
It's not even color.
It's not. It's just.
It's like more like wavelengths and stuff.
Yeah.
God only knows what that even looks like.
Crazy.
That's what I'm saying. So it's like
crazy.
I think you would want a break and not have that like permanent.
Seriously. So right now the lenses only pick up strong IR sources. So think like LED beacons, not like warm bodies. You're not going to be like in that military zone, like or tracking like people moving and stuff like that.
Like exactly. The predator that is like.
Can you imagine? It's like if I'm home alone, I would want that.
Yeah.
To like make sure there's like no one.
Yeah, but then you wouldn't sleep.
No, I would not sleep. Like, can you imagine if I see something?
That's
it's
what
like
I'm saying.
Something else.
You just wouldn't sleep.
I wouldn't sleep ever.
And what about if it's a ghost? What about if we start picking up ghosts?
Well, I mean, yeah, that would be something.
They'll debunk it. It'll be like, is it real or is it not?
Listen, if I saw an image of anything moving,
that's what I'm saying.
I would freak out. Anyways. why this matters.
Other than seeing ghosts.
Yeah, other than proving that there's ghosts or not. So future tweaks could also bring full thermal vision or help people with color blindness by shifting hues so that they can't see in one, but maybe can see in another.
That's super cool.
Yeah, that's really, really cool. There's a spy movie bonus.
Yeah.
Messages. Wait, let me just read this. Messages sent in the IR would be hidden from anyone not wearing.
Yeah, so you'd be able
lenses.
like to send like let's say you're like in a spy movie, so you could send like messages to only people that can
Can see it.
infrared.
Yeah.
Like you can manipulate this new ability to so many
To
things.
so many things. Oh my God, Julie.
It's mind blowing.
Yeah. It's crazy.
Yeah.
Okay, do I need to read that again? Let me read it again just in case.
I mean, sure.
Okay, so, and then if you didn't think that the coolness could get any better, imagine if you're like in a spy, you're like a detective or something, or I want to send Julie like an encrypted message about some bitch. I'm just
Yeah,
kidding.
yeah.
And then, but only she could see it because she has
The contacts.
The contacts.
So
That's
I
crazy.
could see infrared, but not
Yeah.
the other people around. So
Yeah,
it's like
exactly.
secret messages.
Crazy. So anyways, the human eye right now can sample less than 0.01% of the electromagnetic spectrum. So that's that big wavelength that we were kind of talking about. And then these lenses are an early but clever push to widen that little piece that we can actually see. It's not like sci-fi implants. It's just pretty much a higher, crazier version of a contact lens. And then obviously it's still experimental, like what they're saying, like you have to have these strong type of, I guess,
Like contact lenses, I mean.
yeah, but like these nanoparticles, like the way that they works, they need to have something like really strong in order for them to
Even
back
see it.
that. Yeah, exactly.
Yeah. Hey, but it's a
That's-
first step.
That's crazy. I mean, I feel like this for like military and
Oh,
all of that is going to be
100%.
really, really important.
Huge. And they already probably use like a certain
Something like that, yeah.
something like it.
But
But
contacts?
exactly.
Yeah.
So it's like so much smaller and all that. And then you could potentially maybe not even see it.
Yeah.
You know, like see people wearing it is what I mean. But anyway.
Mm-hmm.
All right. So next up, revealed. UnitedHealth secretly paid nursing homes to reduce hospital transfers. Because are we shocked? Are we shocked? No. This is by George Joseph, May 21st, 2025, by The Guardian. Or, I mean, published at The Guardian. On The Guardian.
On the Guardian.
Anyway, so UnitedHealth Group, America's biggest healthcare colossus, okay, because I didn't know that until very recently that it is the biggest,
Yeah.
in the States. Anyway, so quietly paid nursing homes cash bonuses for keeping frail residents out of the hospital, an internal program uncovered by The Guardian shows. The fewer ambulance rides a facility logged, the fatter its quote-unquote premium dividends or quote-unquote shared savings would get checked. So how it worked, UnitedHealth embedded its own nurse practitioners in nearly 2,000 nursing homes and tracked a metric called admits per thousand. Hit the low target and you got a payout. Below the budget and the money was clawed back.
Yep. I'm not surprised.
I'm not. That's the thing. I'm really not. But you know what? I'm surprised and I'm thankful that it finally was exposed.
Yeah.
That's a good thing.
But they're gonna just say that that's false and that those cash bonuses have nothing to do with that and blah 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 blah, which is awful. It's absolutely awful.
Let's see. Staff say that they were nudged to push residents toward DNR, which means do not resuscitate orders, and to second guess 911 calls, even for stroke-like symptoms. Because hospital transfers wrecked the numbers. What's a real world fallout if this wasn't clear enough? Whistleblowers cite cases where delays left residents with permanent brain damage. Families often had no clue to these secret incentives that were being influenced for all these care decisions that were being made. One remote UnitedHealth clinician allegedly told nurses to wait 4 hours before sending a slurring, paralyzed resident out. That's precious time for a stroke. If you guys didn't know, like for a stroke, the sooner the better.
Yeah.
Like you cannot
there's a
wait.
time window.
Right.
Right? So when people start experiencing stroke symptoms, then you need to act fast. Because if you wait 4 hours, okay,
4 hours.
then you're most likely, if this is a true stroke, you are most likely going to suffer irreversible damage. And it could actually complicate the picture a lot more.
It's crazy. Anyway, so
Like, where did that 4 hours come
I know.
from? What is this ambiguous 4 hours? I'm sorry. Can someone show me the evidence to that?
For that
Like,
person
where
to
did you get
pass?
that? But like, where? Because when we make protocols, right? Like at the hospital, if you see stroke symptoms, there's a stroke alert,
Right.
right? So it's like a code blue, but for a stroke, right? Why? Because you need to have all hands on deck immediately. So how does it make sense that if someone is having stroke-like symptoms to wait 4 hours before calling an ambulance? No, it doesn't work like that.
Yeah. It's
So, you know, when you call a stroke alert, it's like the whole entire team comes in. Everyone is prepared to go down like a neurological like path
assessment.
and like a protocol.
Yeah.
So it's exactly like a code blue, like a cardiac arrest. There's a certain protocol that you follow. And we follow these protocols not just because they're like the steps that people just like a flow chart. No, it's because these steps are usually evidence-based practices and they come from best kind of management so that your patient has the chances of the highest, one, survival, and two, with the less amount of sequelae that you can have from that.
I don't know. Anyway, so of course, here we go to kind of what you were alluding to.
Yeah.
The insurance system program prevents quote unquote unnecessary hospitalizations and improves outcomes. It calls accusations of denied care verifiably false and points to studies showing fewer complications when elders avoid ER trips. So why does this matter for all of us? Medicare Advantage pays insurers a lump sum per enrollee. Every avoided hospital bill can turn into profit.
Yeah.
So if incentives lean too hard on cost control, residents may lose critical treatment windows. Congress and the Justice Department are now poking around, but for the families, the takeaway is clear. Ask who's driving the medical bus at your loved one's facility, the bedside team, or the balance sheet. So just be an advocate for anybody. If you have anybody in one of these long-term healthcare facilities or whatever it is, be on the lookout. Be on top of them. And I know it's hard because a lot of people don't have time or the know-how or whatever, but you have to be, because unfortunately, look, like they're being paid to not, it's ridiculous. It's just absolutely
I don't know.
horrible.
I have a really bad opinion about a lot of these places. And I know not one place is made equally like the rest, but most of the time these places are a disaster. And a lot of it, they're not even calling you until your loved one is in the ambulance on the way into the hospital. And it's really sometimes shady. Like
100%.
I've had to ask what medications and what this, and they're like, well, we're not allowed to tell you. And I'm just like, what are you talking about?
How are you not allowed? And
Yeah.
like, oh my God, it's ridiculous.
So I don't know. And unfortunately, like a lot of these places, you know, they want that cashback bonus.
Yeah, of course.
Right.
Of
So they're gonna, like, how is that legal?
That's the thing.
How is it legal for you to incentivize
That blows my
without
mind.
you knowing that there are repercussions? I understand. I don't think that you need to send every elderly person with a fever to the hospital.
Nobody's saying that.
Okay. However, like
Signs of stroke.
signs of a stroke.
Hello?
Like, say if a person stops breathing, are you also going to wait 4 hours?
That's what I'm saying. I mean, there's a clear like,
Yeah.
yeah. Anyway, this is right up your alley.
Yes. Okay. So this next one, children eat more per day after watching just 5 minutes of junk food advertising. This is by Jane Kirby, and this came out on May 11th on Independent. Show a child just about 5 minutes of ads for high-fat, sugary, or salty snacks, and they're going to want to go down an extra 130 calories that day, basically on a fun size like chip bag or chocolate bar. That figure comes from a 240 kid study that unveiled the European Congress of Obesity in Malaga. I think it's Malaga, right?
Yeah.
Or Malaga. No, Malaga.
I think it's in
Malaga.
Spanish, so
Yeah,
Malaga.
TV, TikTok, even like podcasts and breaks that nudge
ad.
consumptions. Yeah, any single ad.
Yeah.
Short bursts of that marketing had the same effect across every platform. And I don't even think this is just for food, right? Like this is just toys too.
Yeah, yeah.
2 minutes of a toy, your kid is going to turn on and say, I want that toy.
True.
Right?
True.
So children with higher BMIs were even more responsive to advertising. Children with higher BMIs were even more responsive to the advertising, polishing off more snacks and lunch calories than their peers that often have the same exposure. And I think that's the reason is because, once you are in like this hole of just like sugary things, it's just more of an addiction for that same kid. And a lot of these things, I also tell families, like a lot of these foods, like these sugary foods and drinks, they're marketed for kids. They're going to have the fun colors. They're going to have the glitter. The advertising is going to be like all kids, like super happy, jumping around and all these things. They're like trying to get that age.
Right. Yeah.
And then on top of that, apart from the fact that sugar is an addiction, right?
Yeah.
For kids, it can be super addictive. Then apart from that, it doesn't have any fiber. So I got a lot of parents that are like, well, yeah, they just ate this. And then 20 minutes later, they want to eat something else. I'm like, yeah, because everything that they are eating doesn't have any fiber. So there's nothing filling them. You're literally just giving them sugar.
Yeah.
Yeah, their stomach is going to be full at some point because it needs to tell you to stop at some point. But after like 20 minutes, give it a chance and you're going to be hungry again.
Yeah, it's not going to last.
So starting October 2025, the UK is actually going to ban junk food ads aimed at under 16 from the TV from 5:30 to 9 p.m., which is amazing.
Yeah.
And it's all paid for online slots any time of the day. So billboards and other outdoor ads remain fair game for now. But officials say that clamping down on all of this could prevent thousands of obesity cases. Yeah. Kids are basically like walking targets for slick food marketing and those harmless cartoon burger spots that stack up fast. Roughly a pound of extra weight for every 4 weeks if that 130 calorie bump became a routine. And 130 calorie, that's nothing.
That's nothing.
That's nothing. Like, I feel like kids are ingesting way more than 130 calories of extra crap.
Of course.
Imagine that's just with 130. If you really look at it,
it's way more
than that. Way more
so
than that.
Imagine.
Yeah. So the upcoming ad blackout won't solve the childhood obesity on its own, but it's a really good like strike on one of the stealthier culprits. This is the same thing for vapes and adolescents. Vaping companies will target adolescents.
Yeah.
So they're going to target on who's showing the vape,
exactly.
how it's decorated, how someone looks so cool smoking out of it, the colors, the name, like Jewel, you know what I mean?
Yeah.
So all of these companies, they are marketing for them because they know that that's their vulnerable population.
Of course.
I know that's a little bit off topic, but it's really nasty, the stealth kind of companies that say that they're not advertising for kids. And it's like, yeah, you are. Yeah, you are.
Yeah, the marketing behind it is undeniable.
Yeah.
Like for sure. Hey everyone, before we jump into this next segment, I need to give you a quick but really important update. We originally recorded the episode that you're listening to on June 1st, 2025. At that time, Adriana Smith, a Georgia nurse, was still on life support after being declared brain dead back in February. She was around 9 weeks pregnant when her brain clots happened. And because of Georgia's strict fetal personhood law, doctors were legally compelled to keep her body functioning to sustain the pregnancy. But as of June 13, Adriana's baby, a boy named Chance, was delivered via emergency C-section at just 25 weeks. He weighed 1 pound and 13 ounces and is now in the NICU. According to his grandmother, Chance is just fighting and so far is expected to be okay. Adriana was removed from life support on June 17th, just 4 days after the birth. Her family never consented to this drawn-out process, and this case continues to raise massive questions about bodily autonomy, ethics, and how these laws are being applied in real time. Okay. Now here's what we recorded before all of this unfolded.
This next one.
Yeah.
This one's big.
Yeah. This one, I had to put this one in.
Yeah.
You know, it's important and it was everywhere. So a brain dead woman.
You did say you weren't going to get political.
It's not.
This is a little political.
It's
not. It shouldn't be, right? It should not, but it is.
I know. But like this.
I know.
It's not her RFK and the.
No, we're not talking about Maha, but this could be. This was hot. This was hot news.
We're not going to be talking about Maha and all of that noise because that's pretty much what it is these days. So, anyway, I thought this had to be included. Anyway, so a brain dead woman's pregnancy raises questions about Georgia's abortion law. This is by Sam Gringlas, May 21st, 2025 on NPR. So a 30-year-old Atlanta nurse, Adriana Smith, was declared brain dead in February while 9 weeks pregnant. Emory University Hospital has kept her organs working for more than 90 days. She's now roughly 22 weeks along because at the time that this came out, because clinicians feared Georgia's 6-week abortion ban called the Life Act.
Which is like, they call it something else too. It's called like the heartbeat law. So once you detect a heartbeat, basically, that would be it.
Might criminalize withdrawing life support. So these are the key details about this. So family members say that they never truly got a choice and worry prolonged ventilation could harm the baby's development.
Yeah, so the family did not have any say in this.
Yeah.
This is like the big thing. The family is specifically saying that they wish that it's their daughter. Like they wish that they would have had no choice. They had no say. They wanted something.
Yeah. They literally had no say in this whatsoever. So the Life Act treats a fetus as a legal person. You can't even claim it as a state tax dependent, adding extra legal risks for doctors. Attorney General Chris Carr insists on plugging the ventilator isn't an abortion, so doctors are clear to act. Emory's lawyers won't bite. Felony charges are still on the table if they guess wrong. And then you have the state Senate, Senator Nabila Islam Parks, calls the situation inhumane and demands written guidance. So what are the wider stakes here at play? Because there's a lot. So post-Roe already contributed to two other preventable maternal deaths in Georgia, which has one of the nation's worst mortality rates for Black women already as it is. Legal scholars warn that broad personhood language could ripple into IVF rules, child support law, even future census counts. And this showdown might climb all the way to the U.S. Supreme Court. One statute has effectively turned a brain-dead woman's body into an involuntary incubator. There's so many things. Anyway, it's a stark example of how fetal personhood laws, these words, like fetal personhood laws, can collide with medical ethics, leaving families, clinicians, and patients stuck between heartbreak and handcuffs.
Yeah. And like,
the way that this is like so close to Handmaid's Tale is just...
Yeah. Which is, a lot of people are kind of upset because what are women? Like
incubators.
Like, are we just incubators now? Like, this
is what happened.
Yeah.
So that's the part that it's like so hard to grasp from this case.
So much, like, even down to the medical science of it, which the doctors can't even do anything about because they're scared shitless that they're gonna go to jail.
I literally just said it. Yeah. Like, nobody can. Everybody's like, I don't know what to do.
I don't know what to do, and we're not gonna.
The lawyers don't even know what to do.
But also, I don't have all of her medical papers, right? So I only can speak on what the articles have been showing, what online is showing. But if she truly is brain dead, right? If we are truly, the hospital is truly just keeping her organs alive to carry her to term, or at least viable for the fetus to be born, the amount of medications that you need to sustain harvesting organs is insane. And even then, it is not enough.
Yeah.
So you actually have no idea of the perfusion that you're actually having to that baby. A lot of the experts have said that this will likely come with complications. And there's other sides of people saying, well, maybe not. And I'm like, but maybe yes. You don't know that. So when this baby is born, that's something that's really heavy for the family, which the family is already aware of. And they're scared, right? They're scared of what's going to happen. And also, if I'm not mistaken, this mom was already transferred to another facility because of how bad she was doing. Well, she's brain dead, but how bad, like, the actual situation, because I'm pretty sure there was already complications with the fetus. And also, let's just say, what if they lose the fetus? They just did all of that? Like, and also, who's paying for that? Who's paying for that? So who's going to get that medical bill? Because the family didn't have an option.
Yeah. Yeah.
So you think the hospital's going to stay with that? No.
My thing here with this view, which I obviously am vehemently against because I just cannot grasp it in any way, no matter the angle, I cannot grasp it, is these people are always like, when I say these people, I'm talking about people that are anti-abortion, right? They're like, no, you can't. Abortion is whatever, all these words, right? It's horrible and all the adjectives to that. They are a lot of the time referencing that like from a religious background, from like, no, because it's natural and an abortion is unnatural and this and that. I'm like, how is this natural?
Yeah.
How is
this
keeping
natural?
a woman that is dead, okay, on machines, on medications, on all these things, that is not natural. That baby would have passed with her.
Yeah.
That is the natural situation here.
Yeah.
So what you are doing by keeping her as an incubator, okay, and pumping her with all these things like you said and all the machines and all of that to keep this baby alive is the most unnatural thing.
But people would not understand if, unless you're in it, like in this world, you would not understand the amount of medication that we need in order to perfuse all her organs in order for her to be able to carry that baby. Also, people are like, well, it's just, to get the baby to be viable.
What?
Do you know?
It's like,
Do you know what that is? It changes, and depending on the hospital, it's between 22 to 23 weeks. 22 to 23 weeks, okay? Out of 40, okay? Halfway there only, barely, okay? When those babies come out, they can have intraventricular hemorrhages. Their skin is so underdeveloped that it's literally sloughing off. You put an IV in, they lose it because there's no integrity to their skin, okay? They get burns from the lights, okay? Their eyes are not developed. They are intubated because they cannot breathe on their own. Because of the mechanical ventilators, their lungs pop. So they have what's called pneumothoraces. They can sometimes get things called pneumatosis, right? Which is where their intestines literally just implode on itself, okay? So you're talking about all of these complications. People just think that they're going to keep the body alive so that the baby can survive. I'm sorry, but you're just completely ignorant if you think that that's what's going to happen.
and that's my problem with these anti-abortionists people. If you guys are so anti-abortion because it's unnatural to abort or whatever, the case may be, especially when it's something medical like this. It is even more stupid, when it's something medical like this. But it's like, you are literally doing the most unnatural thing. That baby can only survive as a fetus, because it's not a baby yet. That fetus can only survive in an actual living human woman. It can't. Yep. It's just not made. Hence why that baby has to be in there for X amount of freaking weeks. Yeah. Because that's just how it is. That's how it's created, how a human being is created.
Yeah.
And just the mentality of it is just mind blowing to me. I don't keeping a woman as an incubator.
Yeah, that's literally it. That's what she is. She's an incubator. And it's all the damage that they're doing.
Horrible.
Yeah.
And it's true, because that's the thing that people are fearing from this case is how does that trickle on to other things?
Yeah.
Like IVF and all these other things. It's crazy. It's crazy. Anyway, so this is all you.
All right. So U.S. drug overdose deaths dropped sharply in
Good news.
2024. So this is good news. This is the largest one-year decline ever recorded. So this was by Carrie Breen on May 14th, and this was on CBS News. Provisional CDC data show 80,000 Americans died from drug overdose in 2024. That is 30,000 fewer than 2023. The steepest single-year decline ever logged has just pretty much what we're seeing now. That's a 27% drop, yet the toll remains higher than it was before COVID-19, and overdoses are still the #1 killer of 18 to 44-year-olds. So what is driving the fall? One, wider over-the-counter access to naloxone, Narcan, which is the first responder training. We talked about this. And then better entry into addiction treatment programs, billions of opioid settlements, cash funding, harm reduction, and testing for fentanyl. Oh, did we ever respond?
Oh, I'm still waiting to.
Okay.
Yeah.
Shifts in drug use patterns and a shrinking pool of most vulnerable users with previous deadly waves. And also just that was a huge movement because of the overdoses from all of these medications. A lot of education, a lot of programs have come out for us to be able to track people. How many times are they refilling their medications? Who's dispensing them? How many doctors have you seen? How many different doctors have you seen to get your medications? There's been such a tight control. All of these things, the access to Narcan, like we were talking about, testing for fentanyl because things are laced with fentanyl.
Yeah.
All of these things are leading to less drug overdoses, which is honestly amazing.
Yeah.
And even then, it's still too much. All but 2 states saw declines, with some of the sharpest drops in Ohio and West Virginia. Researchers are still trying to figure out why a handful of Western states kind of lagged behind. But experts stress the nosedive could stall if federal funding dries up, or if states divert lawsuit money away from treatment and harm reduction. The CDC reminds policymakers now is not the time to take foot off the gas pedal. Keep pushing for all of these programs, the funding, where the money goes, because that at the end of the day is what is going to give us more education, put out more life-saving treatments, and just better programs for people that are currently in addiction.
Yeah.
A 1-year win doesn't equal a victory. This is obviously good news, but we shouldn't, like they said, don't take the foot off the gas pedal. The overdose epidemic still claims more lives than car crashes and gun violence combined, which it used to be the reverse.
Yeah.
Keeping the curve bending downwards will take sustained naloxone access, robust treatment, and political will. Otherwise, 2024's progress could end up another blip on an upward trend line.
Yeah. So this is great news. I hope it keeps going that way. Because, I mean, I think with Narcan being so readily available has really, really helped out.
Yep.
It's like in the pharmacies and stuff like that now. So it's amazing.
Yeah.
That wasn't the case when we were like growing up or anything like that. I don't think I ever saw Narcan until like pretty recent. you
Yeah.
know?
And I think it's just a different way of looking at it because of a lot of people are like, oh, well, if you just make Narcan available, then more people are going to take it. That's not what we're trying to do.
Clearly, it's the opposite is happening.
Yeah.
Because of it, you know?
It was like the same thing. I don't know if I talked about it before on the podcast, but like during my medical school, like we had to volunteer in a needle exchange program.
You briefly, yeah. When we talked about the opioid
Overdose.
crisis.
Yeah. So at the end of the day, we're not trying to promote people to come and exchange their needles to keep on doing IV drugs.
Yeah.
What we were trying to promote is every single time that they came, they had to get tested. Every single time that they came, they had to go through education.
Yeah.
And not education on how to stay clean. No, education on hepatitis, HIV, all these things, the bad things about drugs, why they should stop. So it's almost like a mini program that they have to do. And then we would exchange needle for needle. So if you had 2 dirty needles, you got 2 clean needles.
Yeah.
But at the end of the day, we're trying to get them to come back for more education in hopes that they will stop.
Yeah. Absolutely. All right. So next one. Forever chemicals are lurking inside of you. Can eating more fiber flush them out? Let's see. Anyway, by Sarah Garone on May 28, 2025 on health.com. So new research hints your morning oatmeal might do more than just lower your cholesterol. It could actually help sweep out PFAs, which is that stubborn forever chemical that's found in like nonstick pans, waterproof jackets, and unfortunately, a lot of blood samples that people are seeing now, unfortunately. So anyway, what the study did. So who and how? 72 men took a small scoop, about 1 gram of oat beta glucan fiber, right before each meal for about 4 weeks. A control group got a rice-based powder. The result? The blood test showed about an 8% drop in 2 common PFA compounds, that they were the PFOAs and the PFOS in the fiber group. That's modest, but it's still the first human trial to show any dietary hack can budge these chemicals. So like, hey, anything that can help, really. Gel-forming fibers like beta-glucan turn gummy in your gut. That goo can trap PFA molecules, march them out the back door, and block their usual recycling loop between liver and intestine. Think of it as like a bubble wrap for your toxins. What was this all about? This was a tiny pilot short time frame, all male participant study. Ongoing exposure using tap water, food packaging, that just wasn't really controlled. It was just like, what's their regular intake of food and their
I
lifestyle.
wonder why all males.
Yeah, I wonder too. I don't know. Maybe it was like a male clinic or something. God only knows. Until bigger trials confirm this effect about the fiber and controlling these PFAs and whatnot, doctors still list only 2 proven PFA clearing methods, which is blood donation and a prescription resin. And that's just pretty rough on your GI. So loading up on whole grain oats, beans, berries, and other soluble fiber staples is already great for cholesterol, blood sugar, and for your gut bugs, which is your healthy microbiota. If future research backs the study, high fiber habits could add PFA's broom to the benefit list, a low risk pantry level way to fight back against an industrial mess none of us asked for.
Yeah.
So, I mean, hey, we already know fiber is good for you, so it might be good for you in another way too.
Yes. And now going back to CRISPR, we haven't talked about CRISPR in a really long time.
This one, I'm glad you're reading this one.
Yeah. So the world's first personalized CRISPR therapy given to a baby with a genetic disease. So this was by Heidi Ledford on May 15th, and this was on Nature. So doctors in Philadelphia just pulled off something that sounds pretty epic. Yeah. They built a gene editing drug for one single patient, which was a 9-month-old nicknamed KJ. Then they used it to switch off the mutation wrecking his liver. So think of it as like hitting the backspace, like if you had like a typo in a 3 billion letter DNA block. So what went wrong? KJ was born with CPS1 deficiency. It's basically a metabolic disorder that lets toxins of ammonia pile up in the blood. Untreated kids rarely reach kindergarten because of this accumulation. Standard medicine had nothing to offer. His team at Children's Hospital of Philadelphia, CHOP, and Penn Med asked the FDA for a one-time emergency green light. Scientists wrote a tiny RNA GPS tag that basically literally tags it, on KJ's exact bad gene, They paired it with a CRISPR scissor, so it comes in, and it's like a CRISPR scissor recipe, all packed inside fatty bubbles and then dripped into his bloodstream. 3 escalating doses later, the liver cells started making the right enzymes. His ammonia levels plummeted to near normal, and he went home thriving.
It's just incredible.
Yeah. Why this matters? Speed. From lab sketch to IV bag took about 6 months. That's incredibly fast.
Yeah.
Sometimes these things take years. Templates for others. The delivery shell is reusable. So swap in a new GPS tag for another rare kid, and they can also get a personal patch. Scientists say that hundreds of ultra rare diseases might be able to be taggable in some way. Now we'll talk about let's get into the reality of things. Nobody knows how long the edit will last as KJ grows, so he'll be monitored for a few years. The price tag, millions, because mass production isn't a thing, and also when the market size is literally just one kid, So think about it, they can't mass produce because it's someone's genetics specifically. Right. Now, regulators and insurers will have to invent a playbook for approving and paying for the bespoke fixes. This case cracks open a future where fatal genetic disorders or these typos could be treated like a software bug and literally find the error, upload a patch, and reboot it and fix it. So It's early days and super emotional, expensive. I don't even know. All these things.
Yeah. I mean, this could be so heartbreaking for families, because it's just these genetic mishaps that happen with babies, and then this could actually help them.
Yeah.
This could be a way of helping them.
Yeah. I don't know how expensive all of these therapies are going to be in the end,
but it could be life-changing.
Family
changing.
Maybe a lot of funding. Maybe there's going to be places that are going to be able to fund. I feel like this is always the same thing in the beginning. Mm-hmm. In the beginning, it's always the expensiveness and all these things, and then slowly when they start figuring it out, and then somehow becomes super readily available.
Companies start finding ways of
To
like
do this, exactly.
of making it affordable
So-
ish or whatever.
Anyways, families that have kiddos with rare diseases or people that have rare diseases just might have some hope when it comes to like actual the CRISPR technique.
Yeah, CRISPR is incredible. If you haven't heard about it or you want to learn more about it, we did an episode that was one of our favorites on just CRISPR and how it works. So check that out. But I'm glad to see it actually in use now too for kiddos.
That's the end for part 1. We did not expect this episode to be a 2-parter as it happens most of the time. But for the sake of keeping this short and not almost 2 hours long, stay tuned for next week for the second and final half of this recap. Hope you guys enjoyed it and hope to see you guys next week.